Okay, well, we're going to talk about a very important subject. So many people have said to me, well, I have neuropathy, and a lot of people don't know what that is. In fact, probably 10 years ago, no one would say they had neuropathy. They'd just say, oh, my hands or my legs are numb, or they had no idea what that really was, and many of them didn't know what to do about it. But today, it seems like we have such good experts and neurologists who really specialize in this field, and one such neurologist is Richard P. Singer, Dr. Singer, who's a board-certified neurologist with neurology clinical research, and actually he conducts studies on the central nervous system disorders. Good. Thank you very much for being on our show, Dr. Singer.
Well, thank you very much for having me.
And you know,
Again.
okay, right, having you again. It's wonderful to have people of your expertise talk to our listening audience about something that they may not even know they have. What are the first symptoms when someone has neuropathy or getting it?
Well, sometimes it may just present as some slight numbness in the toes. Sometimes patients describe it as a tingling-like sensation in their toes or feet. But usually it begins at the furthest point away, such as the tips of the toes, and then sometimes can actually even travel up the leg.
I was thinking about bad shoes. Sometimes you misunderstand if you're having neuropathy or your shoes are too tight.
Right. I mean, sometimes you can have what's called compressive neuropathy, which means something is actually pinching on a nerve.
Huh.
And sometimes changing shoes may make a difference for that type of problem.
Right, but a lot of people are having this because of being diabetic or maybe even pre-diabetes. Is that possible?
Absolutely. I mean, by and far, the largest number of patients I see with neuropathy have diabetes. There are non-diabetic neuropathies as well, and sometimes the first presentation, the first manifestation, as you say, of diabetes may actually be neuropathy. I've seen patients who didn't even know they had diabetes until they were diagnosed with neuropathy.
And is this something that's hereditary, or, if you examine someone, can you tell if they're prone to having this?
There are certain types of hereditary neuropathies which have nothing to do with diabetes, although there is a genetic disposition to diabetes, but just in terms of the whole group of hereditary neuropathies, and they generally are more motor than sensory, meaning that a nerve supplies sensation, but it also supplies a signal to the muscles to contract. And if there's some disruption in that pathway, you can have motor problems as well as sensory problems. So there are a number of motor neuropathies, hereditary neuropathies, and somebody might have very high-arched feet, for example. Sometimes there's a clue. Sometimes they may have very thin legs, which the anatomy of the physiognomy, so-called, of the leg may look a little bit unusual. Bowling pin-type legs are sometimes called. So there are a number of motor neuropathies that are relatively uncommon. By and far, the majority that we see have to do with diabetes or perhaps some other metabolic problem.
And so if someone comes to you and you discover this, what's the first thing you tell them to do? Is it a diet?
No, first we have to discover, look into what's causing it, because you may not know. And so first of all, they'll need a neurological workup. And, initially when you started, you mentioned something about the central nervous system and the different studies that we do. Neuropathy is really a problem of the peripheral nervous system. So that if one thinks of the human body as there is a central nervous system, which means the brain and the spinal cord, and there's a peripheral nervous system, which is essentially after the nerves have exited the spinal cord and traveled down into the arms and legs. And in peripheral neuropathy, that's usually where the problem lies. So what has to first take the history, find out how long it's been going on, if it's a sudden onset, if it's just sort of very insidious, meaning very slow in onset. And the patients often have just a variety of signs when you examine them. They may have, they may lose reflexes in their feet, in their knees, and their ankles. They may have loss of sensation to light touch, to a feather, to a pinprick. They may lose what we call vibratory sensation. We actually examine them with a tuning fork. They may lose position sense, meaning they can't really tell whether their toes are going up or down. And that's by and far the most problematic form, because those patients who have involvement of the position sense oftentimes can have trouble walking because they really don't feel where their feet are in terms of space. They just don't know. So they have to walk sometimes with their feet wide apart in order to maintain their balance.
My goodness, it's pretty serious. And so it's very important, if anyone's having these problems, you go and you see Dr. Singer and Dr. Cutler, his partner, right away, because you don't want to fall. It's one thing to be uncomfortable, but it presents lots of other serious conditions. And one thing I'd like to say is that they do run a lot of clinical research, and it's very possible that you can get into some of their clinical research. In other words, there are some people, do you know, that your skin feels like there's a stabbing and a burning and shooting pains, and it could be a symptom of what Dr. Singer was calling the peripheral neuropathic pain. So they are now doing investigational pain medication that's taken once a day, and you can be under this particular clinical study. They have a lot of clinical studies, but this is one. If you want more information, you'll be able to call them at Neurology Clinical Research, Inc., and the phone number is 954-475-8171. That's 954-475-8171. Reimbursement for time and travel may also be provided, but you will have to be qualified, and they will help you get qualified they'll know if you can be qualified by calling that number. One thing I can tell you, it's really a broad range of age. It's from 18 to 80 years of age. So anybody having this problem, please do call. And getting back to the neuropathy and the peripheral and other kinds, people who have strokes, I noticed that they have problems not feeling a leg or an arm, but that's not neuropathy, is it?
No, that's actually caused by a problem in the central nervous system coming from the brain and loss of sensation. And that there's certain pathways from the brain to the periphery that control those signals. But in polyneuropathy and peripheral neuropathy, it's on a peripheral basis, meaning in the extremities. There are other types of neuropathies as well, and sometimes the terminology gets a little bit confusing, because sometimes people hear the word neuritis or neuralgia, and all these things are essentially synonymous. I mean, shingles, for example, is a neuralgia, which is because some peripheral nerves have been affected by the varicella virus, the chickenpox virus called herpes, and herpes zoster virus. And that's a very painful neuropathic disorder. But it has a different etiology, meaning the cause of it is very different than, let's say, from diabetic peripheral neuropathy. And it can be very, very painful. And there's treatment for that as well. We do clinical trials on that as well. So it's very often to really know, to identify the problem, to do a physical examination to determine what the source of the problem is as possible. And then oftentimes there are blood tests that are done looking for metabolic reasons, such as diabetes, such as vitamin B12 deficiency, such as hypothyroidism. Sometimes a peripheral neuropathy can be what we call a remote effect of a malignancy. Somebody with cancer suddenly starts developing numbness. That could be what's called a remote effect of the cancer, or sometimes it could be caused even by the chemotherapy, very commonly, that the patient has received.
Yes,
Chronic alcoholism can cause peripheral neuropathy.
Really?
As well. So taking the history and examining the patient is very important.
Going back to what you just said on cancer, and a lot of the people who have been treated for cancer with, whether it's radiation or just any of the other treatments, they seem to have that problem. I've heard that before now that you bring that up, that they have now neuropathy. And what was that caused from, the chemotherapy?
Yes, yeah. Chemotherapeutic agents very often, although they hopefully, get rid of the cancer and help save the patient's life, they can have a toxic effect on the nerves, on the peripheral nerves.
And can you do something for them with that?
Well, there's no specific medication indicated for